So I'm suggesting that you find a place that you can retreat to safely. I think, too, if you're noticing a change, you might want to entrust the support of a friend. Let them in, I've seen some changes here, and I'm not sure what's going on. It may be even a family member that you may need to tell, but people decide, who is that trusting person that I want to share this with? And you can't share it with everybody, but you're going to choose someone that's good for you to think about who I want to say, there's some changes I've noticed. Now I want you to be aware you're my friend, and so I need that. If necessary, you might have to, especially if you're noticing things are really escalating and you want to make sure that everybody's going to be safe, especially if there's children involved and they're children that you can communicate with, you could use the code word, whatever it is. It could be mama, whatever, but you could decide, sweetheart, sometimes things are Daddy and I are having a little, some problems here, and we just want to make sure everything is okay. So when I say mama, this is what I need you to do, but you may need to have some kind of a code word or phrase to indicate you need help. It might be when you call that person that you've entrusted in, that you use that code word with that person, so they realize that you're needing help, because you may not be able to say what the problem is. It's you pick up the phone, it's mama, whatever, and they'll know, oh, okay, Marie needs help. And so that would be good for them. Sometimes I think it's important that you memorize numbers. Sometimes you need to even make sure your children know numbers as well, but memorize numbers of people or agencies that might be able to help you. If you're realizing that something is happening, we have Safe Nest and Safe House here, and there's the national hotline number. That might be a way to, you're noticing something, so that's why there's a way to have that number memorized for you. And so I have a number of suggestions, so that's why I'm continually giving some suggestions out. Maybe any one of these will work in some kind of way that you might begin to think about what you may need to do. But it might be, but there's some things that I think will be important that you always have access to, especially when you're noticing change in the household. Cash is one. Okay. Identification, like your Social Security and your driver's license. Always make sure you know where those things are in your person, or you can grab very quickly, but have them available to you. You may even need your birth certificate or marriage license, but at least know where they are. Know where easily accessed in case you need them. This is what I'm talking about. I'm not saying you have to carry them on your person, but I'm saying having access to those quickly or know where they are is real important. Your credit cards or your safety deposit box, keys or bank information, know where that is. Make sure you have some that banking information, or maybe you have to memorize the numbers or whatever it is, but make sure you have those kinds of things. Your health information, your insurance information, that's always important to know who, how those numbers and a lot of us do carry those health cards in our wallets or purses or whatever. So you need to make sure that you have that available. But again, think about whether you're able to grab your purse or not. So there might be a way that you make sure that you have those kinds of things available. And the last thing I might say, that you might have other documentation available in case you need some photos or some police reports that are related to maybe previous episodes. If that has occurred, you might want to make sure that you know where that kind of information is, or are able to have it available. So those are just some of the things that I might suggest right away. It's a lot of information, but at least it gives you a start for some things that this is where I may need to keep these things in mind that Dr. Marie is saying.
Right. You laid it out. You laid it out. Those were some things that I'd not thought about. The other thing I hadn't thought about is when you mentioned in your statistics, you said 1 in 3 women. A lot of times we think about women in domestic violence too, but you forget that there are men in domestic violence situations as well. And I didn't know it was 1 in 4. but you don't hear about it as much. But clearly, I guess there's similar situations. Again, people heightened stressors and things like that. Inability to kind of provide and things like that, I guess, lead to there's the other side of it as well. But it's just, some of the things that I was trying to look at, just trying to glance through. I'm like, wow, how do you just it's there, it exists, but just how do you move to get to the next phase? So as you laid out, those are all good helps to folks out there who may be in need, who may be listening, and that those are good pointers to have. Chief?
Well, I want to add one other thing, though, because I'm here in Las Vegas and you're not in this city. And I think every city may have something different as it relates to a support system. Like there is the National Domestic Violence Hotline. That's one thing. Every city may not necessarily have Safe Nest or Safe House or the Salvation Army or any of these places particularly that they can run to. So I think it's always a good idea to know your neighborhood, know your community, know are there safe houses there, or know where you can call, where, maybe there's a particular church that takes care of people who have these kinds of issues. I just think that it's just always wise to know your community as well.
And Dr. Wakefield, you gave out some incredible information. And, one of the questions that I thought about as you were talking about the various things that people should prepare to have in their possession, but I was wondering, are there, I guess statistically speaking, are there more domestic related incidents, particularly during this time? Are they broken down along socioeconomic lines, racial lines, or is it just one big conglomeration of data that says that there is a problem going on, particularly during this pandemic?
There may be, but I haven't really been able to find the breakout of statistics to say that it's due to financial stress necessarily. I mean, because there's so many things that are related to COVID, for example, the threat of it. I mean, there are people that are afraid, for example, of catching it. So if they're, for example, an essential worker and they can't work from home, so families may vary in terms of the requirements of what's going on, quarantining, staying away. Sometimes families are separated because of the COVID, because I've got to quarantine myself. I'm a frontline worker and I've got to make sure that I don't take this home to my family, or I can't visit or provide for particular people in person. Well, I mentioned the financial stress, but also too, there's there's other things that people have noticed. For example, I've heard not only on the news, but I've also read how there's an increase of alcoholic use, for example.
Sure.
And so that having increased as well due to the COVID situation, and so people have reported that that sometimes there's even situations where, and I was really surprised to learn that the U.S. was reporting that domestic violence perpetrators, for example, they're in these close relationships, believe it or not, will use COVID as a weapon against their victims, forbidding them, for example, to wash their hands, or in an attempt to kind of increase, the control over them, or, they may also forbid them from getting any medical attention in the event they think they're going to get it. Those kinds of things are happening. I haven't heard a real breakdown to say it's this or it's that. Specifically, I think that because it's all new and we're trying to figure out not only how to get past it, but as we're keeping track of the number of cases, I mean, there's an increasing report of domestic domestic violence with as it relates to child welfare, and they're noting the significant drop, for example, in child abuse and neglect. Why? Because unfortunately, this decrease may be the result of fewer opportunities for detection of it, as opposed to an actual decrease in the actual incidence itself. It may really be happening, but now that the kids are not seen by their teachers or other people who may notice it, it looks like there's a decrease in child abuse and those kinds of situations, when that in fact is not true as well. So,
well, let me ask you one question, Doc. The industries that really blossomed during this COVID situation obviously were the liquor stores and the legalized marijuana places. In your opinion, do you think that increase combined with people being quarantined, did that contribute at all to the spike in domestic violence?
It may have. I mean, there's two sides of it. On one hand, people may not have necessarily have the money for those kinds of issues, and they're worried about evictions and other kinds of things. But on the other hand, you have people who also need these particular the venues, whatever it is, whether it's the marijuana or whatever it is that they've been using for whether it was recreational or for their own medical release of something that's going on with them, and not being able to get that is another side of it as well. I don't know. I don't see that as necessarily something that's going to be high on the scale of the causes or the spiked numbers of domestic violence, as I see it more in situations where we're now in close quarters. We're now not being able to do all the things we usually are able to do. We can't go the places we go. We can't hang out like we were doing. I see these other kinds of social kinds of things, because we're social beings. A lot of us are. And that it's tough for us when we can't do the kinds of things that we've been doing. And so even though we may enjoy alcohol or marijuana or all these other kinds of things as, kind of something on the side, I don't know if that's going to be touted as high on the scale of a cause necessarily as it is, if we're looking for cause and effect, as we are looking for patterns of control, and now we're in confined areas.
Sure. And it's interesting now that we're in a pandemic, that out of all the issues that we are going to encounter, that domestic violence was one of those issues. We talked about, people not being able to interact, not being able to go to certain places, having to wear masks and the whole 9 yards. And, it's just interesting now that we have had this phenomena to occur. It's almost as if we are ever struck with this type of pandemic situation again, one of the preparatory things that we have to do is to make sure that people can get along, that they have the mental capacity to deal with the situation. And so, that's one of the things that I've found very interesting. But what we're going to do, Dr. Wakefield, we know you have a lot of great information, and we also want to talk to you about this incredible program that you've been working with for many years with your sorority, with Delta Sigma Theta Sorority Incorporated, the STOMP program. So we want to hear a little bit about that after the break. So I want everybody to stand by and stay by your radio or by your phone or by your computer. And we'll be right back in a few with Dr. Marie Wakefield as she talks to us about the spike in domestic violence during our COVID situation. So stay by your phone, stay by your computer.
This is Straight No Chaser Talk Radio. We're just getting started. Straight No Chaser Talk Radio.
He's drinking that with no chaser.
Oh, yeah, that sounds good.
You could be spreading the coronavirus without realizing you have it. So do your part and stay home.
It's important to limit in-person interaction with anyone outside of your immediate household, but phone and video chat are safe ways